Sorry, Ashley.
Is there anybody at the moment who has tested positive in home quarantine? Do they have the UK strain?
I'll ask Dr. McAnulty to answer that, but I think there is. But can I just say this, that I mean, getting overly obsessed about a British variant or a Nigerian variant or a South African variant, there are many variants, and those variants are out there and they're coming from many countries. So as we move forward, we can expect it to become more of the norm, because we're getting more and more people who have positive cases coming from overseas. As the virus does its worst across the rest of the world, Australians coming back are more likely to have the virus or a variant thereof. So, of course, we have to manage that issue, and we are managing that issue. But I'll ask Dr. McAnulty to comment about the cases that are in the current environment.
Thanks, Minister. So we've had a total of 18 variants of concern since November. Of those, 14 remain in the special health accommodation. We have processes in place where there's a review of every person in the special health accommodation with COVID to make sure that they're being tested for the variants of concern, and then an expert panel will assist in making sure they're not discharged prior to them being safely to be able to be done so. So there are 14 people, I understand, in the special health account. Yes. Yeah. So there are two main ones, but new ones are emerging around the world. So we've had, and they're named after the country where they were first identified, but that doesn't mean that they're not in many other countries as well. So we've had, of those 18 in total, we've had 5 from South African strain and the remainder the UK strain.
Oh, look, this is something that we're progressively rolling out, and obviously we've got the Dine and Discover vouchers that are coming out very soon, and if you want to access that, you're going to have to download the Service New South Wales app, because again, it provides people with that ease of use. But let's not scoff at 3 million. That's a significant number of people in New South Wales. When you think that we've got a population of 8 million, about 6 million adults, and say 5 million of those that are, shall we say, engaged. 3 million is a pretty good milestone, given that we only made this mandatory as of 1 January.
Are you confident with the system that's in place that there might be outages from this out?
Look, we saw an example of that last week, I think it was, where we had 2 hours of outage. Now, am I saying that digital is perfect, QR code is perfect? No, it's not. But it is a damn sight better than paper and pen. We've had over 30 million bits of information going directly to the contact tracing team at Health. Now, that's information that's going in a digital format through QR codes that previous to QR code would have been done in pen and paper. Now, as Minister Hazzard said time and time again, pen and paper, there's enormous irregularities around that you don't get with digital. So what we've seen in this pandemic is that we have to be fast, we have to be agile, and we have to be laser-like, very targeted, and digital's the only medium to do it.
After that outage last week, has there anything changed to ensure that doesn't happen again?
That was a technical problem that has been resolved, and we are constantly learning through this pandemic, and the IT systems are no different. But we are stronger today than we were yesterday and 2 weeks ago. But there was a glitch for 2 hours. But equally, when there is a glitch in the system, there's always fallbacks. And in the case of last week, there was always the ability to go through the web browsers and put your details through the web browsers. And in fact, in the half hour prior to us fixing it up, there was about, I think, 17,000 people that used the web browser. There's also the ability for businesses to record through their tablets and their electronic devices. And again, as the ultimate fallback, you've got pen and paper.
Mr. Hazzard, just given that there are 14 active cases of different variants, are you concerned at all what's happened at the Hotel Grand Chancellor in Brisbane
Look, I think the Queenslanders are actually working their way through a review of what has actually happened at the Grand Chancellor. I think it's fair to say that we're always on high alert about what might happen. It's a human system. I suspect that in the end they'll find that there was some human breach there as well, but that's a matter for them. I have confidence in our public health system and in the quarantine system, and our public health team are second to none. So the people who are managing these health hotels and the police hotels are doing an excellent job. And I want to add, actually, since I've been asked, I want to thank, I was reflecting on this a little earlier today, that we've all come just to accept the fact that there are thousands of health staff at the front line still working on this, public health staff working 24 hours a day, police working massive hours. I think we should, as a state, be very grateful for the fact that we have so many committed frontline staff on this in this COVID pandemic. So thank you on behalf of the community and the government to all those staff.
May I ask, it may be a question for you or maybe to Dr. McAnulty, of those people and of those strains, are we concerned that there has been any transmission between those people in a similar way that we've seen in Queensland?
No.
So therefore,
Oh,
how transmissible?
I'm glad he's agreeing with me. No.
But
No.
how transmissible are these? Obviously, these people are on planes together. Yes, they
Look, the virus. We wouldn't all have a pandemic if they weren't highly transmissible. The virus is transmissible in its original forms, but now there are variants that are, as we're describing them, variants of concern because they are even more transmissible. But the good news so far is that there's no indication, no clear indication anyway at this point, that they make people sicker. They don't have any great difference except the fact that the transmission is actually much quicker and it would appear to be more transmissible. So that certainly has implications for us, implications for everybody around the world. But we're also looking forward, can't tell you how much I'm looking forward to getting the vaccines rolled out as soon as the TGA and the federal government think it's appropriate. I'm really looking forward to that.
Will those variants reduce the effectiveness of the vaccine?
Sorry.
Will those variants reduce the effectiveness of the vaccine?
No, actually the advice to date from the epidemiologists is that the vaccines that are coming to us will have equal effectiveness with the variants, so that's not really an issue.